Available statistics show that Nigeria has the highest number of HIV infections among children globally, with 1 out of every 7 child born with the virus. An estimated 1.8 million people are living with HIV and AIDS in Nigeria, out of which 1.6 million have been placed on treatment. Providing care for infected persons over the years has, however, been a challenge in the country. In fact, it is estimated that 75% of HIV and AIDS response is funded by international donors, while about 25% is funded by the federal government, with little contributions from the states. With increasing global uncertainty, experts have harped on the need for Nigeria to do more to fund its HIV response. Finding ways to finance the response in Nigeria is the reason President Muhammadu Buhari launched a 62.1 billion naira HIV Trust Fund. The HIV Trust Fund aims at providing sustainable financial mechanism for the mobilization and deployment of domestic resources towards addressing the prevention of mother-to-child transmission in Nigeria. On this episode of Nigeria Today, we shall be looking at HIV prevalence in Nigeria and efforts by key players to tackle the virus. I am Lydia Ochi. Thank you for joining us. Joining me in the studio to speak on issues about HIV response in Nigeria is Dr. Gambo Aliyu. He is the Director General, National Agency for the Control of AIDS, NACA. Glad to have you on the program.
Happy to be with you, Lydia.
Okay. HIV and AIDS has remained a public health issue in Nigeria over the years, despite increased awareness about the virus. We'd like you to give us an outlook of the current level of prevalence of the virus in Nigeria.
Thank you, Lydia. So the current level of HIV distribution in Nigeria is such that if you had to have, let's say, everyone in Nigeria placed in one room, and you select 200 people at random, and you give them HIV testing, it is likely 3 out of those 200 will turn out to be HIV positive. Wow. This is quite different from what the situation was, or was believed to be, several years back, let's say 2004, 2005, when if you did such kind of random pick of 200, 9 out of those 200 may turn out to be HIV positive.
Wow. So that means there's a reduction, great reduction. Wow, that's good to know. There is
great reduction in terms of distribution.
Yes.
There is great reduction in terms of transmission. There is great reduction in terms of death from HIV.
And awareness has increased. Awareness, I believe.
Awareness has increased a lot. Okay. Awareness has increased, and there is also reduction in stigma and discrimination.
Okay, that's one good reason. Now, from available data, mother-to-child transmission of the disease is still very high in the country, with an estimate of 1 out of every 7 child. What could be attributed to this?
The rate limiting step there is getting the pregnant women to come forward and take HIV testing, which has been a challenge, especially with pregnant women that don't deliver at hospitals or facilities where antenatal services are provided. And over the last several years, we have made an effort to ensure that every pregnant woman that shows up at a facility, especially the government and private facilities where antenatal services are given, and turn out to be HIV positive, we have a 100% success rate in preventing that baby from having HIV from the HIV-infected mother. Okay. However, where pregnant women don't deliver at hospital facilities and don't have access to HIV testing, there is that increased risk of mother-to-child transmission, especially when the mother is HIV positive and she doesn't know that she has HIV, or she knows she has HIV but is not on life-saving medication that will suppress the virus to prevent the virus from leaving her to pass on to
the child,
unborn child that happens usually in the process of delivery or after delivery during breastfeeding.
Okay. Now, what is the current response in the country in terms of tackling the menace of mother-to-child transmission?
We're changing strategies. This year, 2022 in particular, there will be increased activity at community level. We'll reach out and meet the pregnant mothers wherever it's convenient to meet them. We know some pregnant mothers access those services at religious places of worship, some at community centers, some in the neighborhood where they access antenatal or access delivery taken by trained nurse midwife in the neighborhood, or traditional birth attendant. So we are mobilizing resources to use traditional birth attendant, to use trained midwife that are located within community structures, and also to make self-test kits available.
Okay.
If couple feel strongly about coming over to access HIV services through facilities or through a third party, they have the option to having the tests available to them, and they can administer it. It's simple, using saliva, not even blood if they so want, at the comfort of the room to see whether whether that pregnancy is positive of HIV or negative.
Okay. Things have really evolved. Well, what would you say are the main areas of progress in Nigeria's response to the HIV epidemic?
There are three big groups that HIV thrive in. We have the general population, which is virtually everyone you think of, and we have the key affected population. The key affected population are the major drivers of the epidemic, because they are at higher risk of acquiring HIV, and they are also at greater risk of giving HIV to others. These are the sex workers, men who have sex with men, the transgenders, and people who inject drugs. These individuals have high chance of getting HIV, especially when there is some kind of a contact that is put individuals at risk. And the general population is where we have made a tremendous and visible gain. That is the figure I was quoting at the beginning, saying that in the past, if you take everyone and put in one room and randomly select 200 people, 9 out of those 200 people would turn out to be HIV positive. But these days, you may see only 3 instead of 9. So that's how how tremendous that progress has been with the general population. With the key affected population, a couple of years back, we have had only 10 or less than 10 one-stop shop where we say we provide services that are convenient, that this population that is affected and is at high risk and are driving the transmission in the community feel safe or feel comfortable to access those services. As of today, we have over 100 of them, and there is increased awareness among this population, and there is what we call PrEP, pre-exposure prophylaxis, that will prevent the negative party, and this is the same where you have discordant couple, where one person is HIV positive, the partner is HIV negative. That partner can be prevented from having HIV by using medication, as well as treating the partner that has the virus to suppress the virus and make sure that the virus doesn't show in the blood.
Now, the issue of funding has remained on the front burner for years now, with international donors contributing a huge percentage of HIV and AIDS response funds. How important is it for Nigeria to domesticate this funding?
It is important because fighting HIV has two phases. The first phase is controlling the epidemic, achieving epidemic control. And what it means to achieve, epidemic control is virtually to identify almost everyone that live with the virus in the community or in the society and put them on life-saving medication. When that is done, that virus will be restricted within these individuals. It doesn't show up in their blood, and certainly it doesn't get transmitted to others. In that situation, it means HIV has been effectively located, and HIV has been effectively localized and immobilized, and HIV cannot move around in the community. So that is the first phase. However, the continual process of immobilization and restriction and keeping the virus where you want it to be and continue to watch it so that it doesn't move would require significant investment. And this is where the current international partners that are helping us to reach that bridge where we will say we have achieved epidemic control and now we're going to sustain that achievement.
Okay.
Yeah, is about to happen. Okay. So once that happens, then the sustenance will be our responsibility.
Okay. Okay.
And providing about 2 million people living with the virus the medication that they need every day for as long as they live, to make sure you immobilize and keep that virus where you want to see it.
Okay.
Yeah, is the challenge.
Okay. We'll take a short break now. The conversation will continue shortly. Don't go away.
This is NTA News 24 broadcasting from Abuja. You can watch us anywhere, anytime on the following platforms.
Start Times Channel 101, Free TV Channel 703, GSTV Channel 419, and Go TV Channel 46.
For more information, log on to our website www.nta.ng or join us on our social media handles, Facebook at NTA News 24.
For comments, suggestions and inquiries, send an email to news24@nta.gov.ng or call us on the following numbers.
NTA News 24,
news and more news.
Welcome back. The program is Nigeria Today, and we are discussing domesticating HIV and AIDS funding in Nigeria. Our guest is Dr. Gambo Aliu. He is the Director General, National Agency for the Control of AIDS, NACA. Dr. Gambo, just yesterday, President Buhari launched a 62.1 billion naira HIV and AIDS trust fund. We'd like to know how this fund, or how this trust fund, is structured. Who is involved, and how will this money be raised?
This trust fund is 100% driven by private sector, and when I say 100%, the management of this trust fund, from the administration to the delivery of whatever services have been delivered, is going to be given by private sector. Okay. And the idea is the private sector in Nigeria has played a tremendous role in the control of HIV in the first several years, and they have earned a space in terms of helping government to fight killer diseases and emerging epidemics, including COVID-19 of recent. But private sector, Nigerian Business Coalition Against AIDS, have been in existence for a long time, and the private sector has been contributing to the fight against HIV. However, there has been no increase until now in terms of private sector participation in the fight against HIV. And this trust fund is that initiative of the private sector to come in and bridge the gap where government and international funders find it a little bit challenging at the moment to fill. And that gap, as identified, exists in prevention of mother-to-child transmission of HIV. And that is why they're coming in to ensure that these numbers that we see yearly, 22,000 or close to 22,000 newborn babies coming to this world with HIV in Nigeria is prevented or is eliminated. And that, that project will continue for the next 5 years, approaching 2030, making sure that by the year 2030, that issue is brought to a complete halt in terms of having newborn baby delivered
without
with HIV in Nigeria.
Yes. Okay. Now, in specific terms, how is this trust fund going to impact on the response to HIV and AIDS?
We need test kits, we need reagents, we need drugs, and we need logistics to move them around. Where the trust fund money is going to come is in providing the services. The money is not going to be managed by government, as I said earlier, and government will make a request. We'll sit down and look at what we have and the gaps we have, especially now that we do a program nationwide we call Alignment. Alignment is a program or is an initiative that enable the government and development partners to put head together and make sure we have one national program. And in that national program, we identify areas where there may be duplication and make sure that there are savings there, and making sure that our services that we provide are complementing each other. So in that case, we're going to provide a space for the private sector. And that space will be in provision of commodities, providing test kits, providing reagents, providing medication that will be used, because now we're expanding the services to community. So as we expand the services to communities and as well as households, we are expecting increase in the number of pregnant women that will be identified to have HIV. In terms of the test kits we use, we will need twice or 3 times the test kits we use in the past annually to screen antenatal or pregnant women to find HIV positive among them. So we will need increment in test kits. We will need increment in reagents that we monitor to see if the drug we're giving them, is really working and is suppressing the virus as the woman approach delivery. And also the drugs that is used also to suppress the virus. This is also commodity that is required, and with increasing number of pregnant women to be tested, and probably with the increasing number of them that are identified to have HIV in them, there will be the needs for these commodities. So this is where the fund is coming.
Is okay. Now, just out of curiosity, is HIV and AIDS, is there still a cure?
At the moment, there is no cure, but globally, scientists or scientific community has found a way to control the virus, where the virus exists within an individual without the virus leaving the individual to affect another person, and without the virus having the upper hand to break the protection or the body defense mechanism that protect the body from having all sorts of illness and diseases. So that equilibrium is what exists at the moment. The virus stays in the body, but the virus is not allowed to show up, and is not allowed to hack down the body defense mechanism to make the individual sick. Who knows, maybe in the next 5 years or 10 years, a cure for HIV may emerge, and that will solve the problem of HIV permanently.
Yes, probably. Now, how accessible are HIV drugs in Nigeria, and are they entirely free?
HIV drugs are entirely free. However, if someone probably seek those services at private location in private facilities, may be required to pay money, and then that is a choice that somebody has. But at the centers where these services are given, especially where our programs are nationwide, the services are free. no money is required, and if somebody is asked to provide or to give money, they should please contact us and let us know the location and or the facility that is involved. Okay. And the way to do it is by calling our center at NACA 6222. We will respond immediately.
Can you call it again, please?
6222. 6322.
Okay, thank you. Now, aside the mother-to-child mode of transmission, what other modes of transmission are prevalent in the country today?
As you have seen from one of the studies that we just recently announced late last year, we're seeing transmission more among young unmarried individuals. This is because we believe some of this campaign we do and the services we provide, especially the prevention services, are not popular to some extent with the adolescents and young persons across the country, and probably that is why this increase in transmission among this group is now being noticed. These are the individuals that are usually more friendly to social media and certain group than the traditional avenues like this one, and radio as well as print publication in terms of our campaign as well as our outreach. So this is what we're beginning to focus now, to look at the groups and the networks that the adolescents and young persons usually enjoy or congregate, and see how we spread our message.
Okay. Now, Nigeria is part of the global community that is fully committed to ending HIV epidemic by 2030, like you said earlier. This is just 8 years from now. How feasible is this objective?
Yesterday I mentioned something when I was calling the numbers that have changed over the last 3 years. An example is that from 2005 up until 2019, that's 14 years of active searching of cases, we were able to identify 800,000 people and link them up to treatment. But that year, 2019, we were able to know from a survey we conducted nationwide, and which is the largest so far as HIV is concerned globally. We found out that we actually have probably around 2 million people living with the virus. Okay. So at that particular time, we realized that we have a balance of about 1.2 million to identify. Okay. And the beautiful thing about that survey is that it gave us information on likely geographical locations where we can find this individual. So as I'm talking to you now, just 3 years after that survey, we have identified a link using all the information we have, 900,000 individual to treatment. So this is bringing our total number on treatment medication about 1.7 million. Okay. Going at this rate, there is all the evidence that within the next 12 months, Nigeria should be able to arrest HIV transmission or separate among people in Nigeria.
That's wonderful. And we know that being fully committed to this, we shall end the HIV epidemic by 2030. This is where we'll wrap it up on tonight's episode of the program. Our appreciation goes to you, Dr. Gambo Aliyu, Director General, National Agency for the Control of AIDS, NACA. Thank you for your time and insights on the program.
Pleasure to be with you. Thank you.
I'm Lydia Ochi. Don't forget, you can watch this and other episodes of Nigeria Today on www.youtube.com/NTA News 24 Hub. Thanks for your time. Goodbye.
advertising your goods and services